Health and Human Services initiatives in our strategic plan. But before we do that, we noticed something that was slightly amiss in the request from Public Defense. So we asked Patrick to come back for just a few minutes.
And Jose.
Yes, and Jose is with him, an important part of the team. And
Get the Coast Guard.
they have a replacement slide from what you saw this morning. But
Alrighty.
I'm going to let Patrick start, and then we're going to try to explain what the change is here.
All the red.
Yes, and that's why I need some further clarification. So the difference between the slide you see now, Commissioners, and the one that was presented this morning, it was pointed out after we concluded our session by staff that we had made an error in not inserting our Tumwater funding. So what you'll see is you'll see
Just a few dollars.
PCR costs, 2019 new expenditures for the Tumwater funded positions in 2020. Those are 3 positions in our office. There's no hit to the general fund.
Yeah, it's revenue there, son.
It's revenue. That's all funded by the city of Tumwater. But obviously, it does. We need to include that. There's no oversight on our part. Appreciate staff pointing that out. But it's in there now.
What is BCR?
The budget change request.
Oh.
It's an acronym I didn't know. People have just started using. No, that's,
Oh my God.
Was that Jose's acronym? Was that your acronym?
I think that we've seen a number of these acronyms.
Since this was my error, I'll take that.
Okay.
Robin pointed that out, so it needed to be included.
What other kind of
Right.
good news you got?
That's it. That's it.
Oh, that's good. That was easy.
Yep.
Anybody else's time.
Better run for the hills, right?
Apparently, we're not going to make it.
All right.
So,
I thought you had a prediction on the Bulldogs, but
we're going to win this weekend because we're off.
you don't want to wear a tie. That's what it is. Huh?
Yes, sir.
Well, you did a good job defending yourself. Now go defend somebody else.
Yep.
So
Thank you.
now we have
All right.
Patrick.
Thank you.
Thanks, Jose.
Health and Human Services Initiative 2 General Fund presentation. Who do we have for this?
Inviting Shelley Slaughter to come to the table.
Slaughter. So, is it just you, Liz? Both all y'all can come up. Every one of y'all. So.
All y'all.
Yeah, all y'all. Come on up, Liz. Yeah. So we're live streaming, so you know all that, right? Okay.
So you may want to switch switch the microphone
they have.
when you're
Yeah, that's why I said you got
Liz.
to.
Everyone has them? Yep. Do you have handouts?
We have it all. Relax, we're
If
good,
you've
we're
got
good, we're
extras for the audience, that would be lovely.
We're good. Just get set up. I gotta go get a pen. I'll be right back. So, get set up.
Pen here.
I don't want to use your pen.
Well, I got a pencil.
Oh my God. You got lots of
Keep
stuff.
it rolling.
All right. The background from Robin or Romero, or do you want to just jump right in? Anything you want to say
So
to this or not?
this is focused on your initiative number 2, and I think Shelley's done a very nice job. She'll go over what the initiative is and what the recommendation of this team is, and a little bit about the team.
And also, if I did brief you yesterday, Shelley has made many attempts to gather other team members to have a wider conversation.
The county family?
Yeah, in terms of how this initiative can be implemented. And
All right.
she can elaborate on that a little bit more during her presentation.
Right. We do want to make clear, though, that there was miscommunication in the time of this presentation. So it's possible that her teammates are not here because they didn't know when it was, rather than the other circumstances that are going on.
Perhaps we'll just give the benefit of the doubt.
Yes.
Yes, I take full responsibility for that. With both the Health and Human Services presentations that I'm involved with today, I told my teammates that it was at 2:45, and I sent a correction late in the day to them, so I don't know if their schedules could allow them to participate or not.
Okay.
So take it away.
Yeah. You got the floor.
Commissioners, I'm Shelley Slaughter.
Oh my God.
Thurston County Public Health and Social Services. And I'm here today on behalf of the Health and Human Services team to talk about Initiative 2. And our horizon is that everyone in our community has the highest level of health and well-being. So just to refresh your memory a little bit on the strategic plan, initiative 2, and what we're trying to achieve in this initiative. So the focus is to improve community health, wellness, and safety. Public Health and Social Services is the champion for this initiative, and my fellow teammates included representatives from Civil Superior and Juvenile Court, the Sheriff's Office, the Clerk's Office, and the Prosecuting Attorney's Office as well. I will just note that in our initial meeting, the Prosecuting Attorney's Office wasn't there, but because I had not invited them yet to participate, but were involved in subsequent service.
Okay.
So the real drivers of our success are reducing incidents of domestic violence, but a core part of this initiative is focused on addressing the opioid epidemic. As you're well aware, the Board of Health declared an opioid crisis in June of 2018, and this initiative seeks to address the work at the Thurston County Opioid Task Force that was recently formed, and the Thurston County plan to reduce opioid overdoses and prevent deaths that the task force is currently working on. So this initiative also involves supporting those with substance use disorders through partnerships with the Behavioral Health Organization and Treatment Sales Tax, and improve the mental health and well-being of kids and adults with more program investments. As I mentioned, reducing incidents of domestic violence is a key part of this initiative as well, and that's coordinating across all of the offices and departments in the community to improve our data collection, our joint data collection, and develop strategies together. So our team had the wonderful opportunity to meet and discuss several innovative ideas on how we can work together. And some of the ideas that came forth I'm going to share with you and answer any questions that you may have, and so feel free to ask questions as I go. Joint cross-training for all of our partners was a top priority. Everyone that is part of our team is impacted and serves clients and members of the public that are experiencing domestic violence, mental health, people affected by substance use issues, including opioids, and suicide prevention. So this was something that everyone felt like more training was needed for us, as more and more of those we're serving in the public present to us with those issues, and we're all tasked with handling various parts of the system to address that. So youth suicide prevention was another key area called out in this initiative. And currently we have a child death review committee that involves many different members of the community and of the county, including the coroner's office, the sheriff's office, the prosecutor's office, public health community members. That's part of RCW 70-05-170 that authorizes health departments to conduct child death reviews. The focus of that is to prevent deaths for children under 18 and convene together various members of the community that are involved or impacted by that child's life and strategize together on how deaths can be prevented in the future. There's no funding allocated to that group, but they convene and meet, but wish to focus on youth suicide prevention in light of recent data that we have received that that youth suicide has increased, particularly a extremely young child that recently committed suicide that the team was working on, which spurred the creation of a team called the Extreme Team, which Liz Davis is a Child, Family, and Community Wellness Division Director at Thurston County Public Health, has been a part of convening and involves members of our team. Cool. This specifically focused on youth suicide prevention.
Is it extreme? Is that
Extreme Team.
With an X.
Oh.
It's actually, it's actually,
Maybe.
sorry, it's the Extreme Team 2. Apparently several years ago, one was convened about suicide in general, and this one, the Child Death Review Committee, spent 2 hours on one suicide review recently and decided that because of the growing number of youth suicides, youth suicidal ideation and attempts in our community, that more effort needed to be focused across the community on that. And so that team will be convening for its first meeting
particularly child exposure to domestic violence, which is shown to be one of the most harmful of all the ACEs on the long-term health and well-being of children. And all the members of the team at some level are working to prevent child exposure to domestic violence. So other things that we discussed were a shared social worker, as everyone that presents to our various departments and agencies is looking to coordinate resources. Another was to supply naloxone and purchase naloxone, also known as Narcan. Narcan is the brand name of the medication that can reduce the impacts of opioid overdose and death. So the task force has discussed a public education campaign to prevent opioids, and what we've heard time and time again is that more naloxone supply is needed, particularly the nasal form. There's some injectable form that some of our partners have, but it's not widely available, but we have an opportunity to purchase that at a discounted rate. So that in combination with education is something that everyone felt like that they would benefit from. The Sheriff's Office did note in the meeting that they have already included some naloxone supply in their budget, but additional is needed. So shared data analysis coordination was a big focus of our conversation as well. Each department and office, as I mentioned, has a different role in the system and in the lives of particularly domestic violence, those experiencing domestic violence. They're all tracked in a different way, and so one of our measures of success in this strategy is reducing the incidence of domestic violence, which we can't do unless we know exactly what the incidents of domestic violence are in our county overall, and are they increasing? Are they staying the same? Do we have huge dramatic spikes that we need to address? And we need that data and information so that we can best address it. So, for example, right now, every department and office collects that in a little bit different way. So we might rely on TCOM 911 data for calls. We might use DBPOs, protection orders, for those that are initially filed or requested, requests for service, deaths. There's lots of different ways, but not one consistent person that's responsible for looking at that big picture countywide. So Superior Court also noted that they serve vulnerable children and families that are seeking services that have experienced domestic violence at the Family Justice Center, and they requested additional capacity to meet those needs and expand hours. The clerk's office has domestic violence facilitators, and the team discussed the importance of maintaining those facilitators and the important role that they play in serving domestic violence victims.
Is a facilitator like an advocate, or they conduct meetings? What does the facilitator mean with regard to maintaining?
So the facilitators, and granted, I am not representing the Thurston County Clerk's Office, but I can tell you what I do know from working in close partnership with them for many years on this, is that they assist victims in helping to navigate the system, complete paperwork, tell them the necessary steps that they can take to be safe, and a lot of times they are the first person that someone comes in when they're seeking safety and protection. They'll often go to the clerk's office first to take those first steps, and the facilitator helps them to do that.
So the facilitator is a victim assistance type person?
Yes, and I believe that they have other roles as well, not just exclusively domestic violence.
Okay,
and they may have covered this in another presentation.
Exactly, and so this position or these positions, I can't quite tell, are part of what you heard from the clerk in both of the morning's sessions.
Oh, really?
She's brought them every.
I missed a piece of that.
Every
Totally didn't get that.
time. I know she didn't do a great job of explaining what these positions did.
I heard the words, but I
Tried
didn't
to get
hear
her to say that, but.
Oh, when I
You see,
say
now
facilitator, I
this-
think of a meeting.
Yeah.
What Shelley stated,
Makes
it
it a
brings
little more-
a different
Yeah.
spin as to what the need of those positions are, because this morning it started with they're
revenue.
collectors.
Yeah, which
and-
they're
and
not.
collection of fees, and it was a generation of $132,000 a year. So, and then it was not necessarily related to that because the collection positions are
Oh, boy.
different. So
Oh, good grief.
more than you
Right.
would
I
know.
might need another briefing. here.
So who do I believe? And I don't mean, I'm not pitting one against the other, but I mean, you know, we're told one thing.
So, well, you've been told 3 things
Yeah.
now.
Yeah.
So,
And even
we've-
facilitator,
we've
to
got
me,
to
sounds like
get
a
to the
meeting,
bottom
but
of
victim
what
advocate-
are the
What are the
positions that the
positions?
clerk would lose.
Because at the end, we asked the
And
question.
what do they do?
Exactly.
And I think it was just
got questions
general,
now.
general clerk's staff needs, which at the end never explained what that was. But
That brings up other questions that we can't answer now.
Yeah.
Right.
Okay, thank you.
so
Thank you, Shelley.
I can just share that the clerk has an important role in domestic violence and was a member of the team, and that's the information that was shared with the team,
Yes.
that the team supported. So other things discussed was what important programs that aligned with the strategy perhaps were requested with restricted funds that were not funded, and some of those that came up were maternal child health, early intervention, services intensive case manager, the court's child therapist consultant, and a few other different programs. And then the need for child care for domestic violence victims to prevent them from coming to court and sort of that additional exposure. So lots of conversations and ideas that were narrowed down to priorities that we decided would best advance this initiative. So just to kind of summarize what the major outcomes are of our meeting and our process was that, as I just shared with you, all members of the team supported the need to maintain the clerk's office facilitators and agreed that they're critical to reducing incidents of domestic violence, but the team did not recommend general fund requests under this initiative, and our support for those as they tie to this initiative. All members of the team agreed by consensus that we needed to work together to prevent domestic violence, opioid overdoses, and suicide, and have apply best practices and learn best practices, and that shared education and training would help to advance this initiative and our ability to respond to it. This was a top priority of the team because it benefited everyone and addressed all areas of the initiative. So some examples of those trainings were mental health first aid for both infants and adults, trauma-informed care, domestic violence best practices, and Narcan training, such as the speaker that the opioid task force was able to bring to the community back in August.
Are
Do you need
we
to
doing
pause?
any questions? or
Yeah, go ahead.
Well, I'm stumped now on your first bullet, but not.
Show her where you're at. She's not on the same page.
We're not?
I'm on summary outcomes
Okay.
and priorities.
Okay, go ahead.
Do you need that, sir?
No,
I'm on the same page here.
I'm looking for something else.
Just wondering, not recommended general fund request under this initiative. I'm just wondering, you just got done,
what I assume is under this allocation.
Under this, yes.
Under this allocation of $150,000.
so it's not, what the clerk does is not a high enough priority? It
For,
has not reached.
this allocation, but she's making an argument under the law and justice, as you remember.
Okay, okay.
Okay, I don't
Just-
I
understand.
believe that the
That's blowing my mind, too.
amount
That
needed
is blowing my
exceeded
mind.
what was available and.
That's what I'm looking for, her paperwork.
The amount of the
That's
clerk's
exactly what I'm looking
request.
for.
The clerk's request, yeah, the clerk's request was,
That was in this morning's, we'll find
It was
that for
There's
you.
a bit of confusion going on
it
here.
was
like this.
166,000.
Yeah.
Right.
And also, as you may remember, her request also was included in the courts.
Yeah, that's why I'm like, where,
Right.
I gotta find where she's going so I can.
She has put her request in everyone. So she had asked, I'm assuming these are the facilitators, 1.5 FTE facilitator fund to the general fund. It's roughly $102,000 in 2019, slightly more in 2020, was the clerk's ask for this particular item.
I'm glad I asked what that meant.
I didn't know.
No, it's good to have a
No,
little
no, it's good
clarity.
to connect the dots
Yeah.
because
Yeah.
that's what she presented on the, this is the slide on the law and justice.
Okay.
Oh, and I'm looking at the
And then
one
she's
from the
from the
courts.
courts.
It's all the
And I thought the
same.
two she had, we were just converting from, an ending fund date, moving them on.
No, she has permanent positions. These are permanent
transfer.
positions of people in them.
Okay.
They're being paid for out of these particular 1.5 FTEs being paid from the, help me with the right title here, it's the I'm looking past you,
It's the
Shelley.
legal financial obligation fund.
No, that's
the
the other
LFO?
half, it's the other one,
Gosh,
it's
I'm
that
glad other people are
facilitators
confused
fund.
with this.
The Family Services Fund, I don't remember the exact title. Right, it's paid for out
Oh, my
of court
goodness.
fees, and that fund, like the other, is running out of money for these positions.
So now showing up in courts, law and justice, or law
Yeah.
and justice and PHHS.
And
She's
right?
trying to attach it to anything that'll get it funded.
Oh my God.
That is the clerk's strategy.
But in this role, there's not the recommendation.
So what I'm
This-
hearing from Shelley is,
Not
it is a high enough priority, but it's not recommended for funding under the $150,000 allocation for this
For
initiative.
this
Is
one.
this 150,000?
Is it 100?
100,000.
100.
And 50,000
I'm sorry,
is
so-
in the second portion of our presentation.
Oh, okay.
And with emergency services.
All right.
Right, and you heard her
understand now?
talk of the,
Not really.
the team,
100% I don't.
the team talked about all these
yeah,
different
yeah.
things. They didn't all rise to the top.
Yeah.
No, but it just sounded like Shelley was saying it was all pretty important just prior to getting here, but then we don't
It's
recommend
very
funding.
important, but we can't afford everything, right?
And the position that they're really is actually a business applications tech position, clerk's judicial support specialist.
So
See, we
really
need to
it's-
find out
so it's
exactly
really
what
not a-
these
it's not a
positions, it's
facilitator.
not even
It's not
facilitator.
a
Yeah.
facilitator.
We need to find exactly what it is these
So it's
positions
clerical.
do.
So I'm just going to go as we done procedurally, and let's have her come back.
Yes, have her, yes.
Yeah, I'd rather be told
One-
something
We will
twice or
invite her
3
back.
times than just not at all, but it should be the same thing I hear.
So next week, when you get to the point of getting into this
Yeah.
conversation, then we'll ask her to come
All
back.
right.
And
Sorry about that. We had to get something straight. We think we have it straight. We got drive on.
Okay, so
Oh my
the
God.
area that I was on
Glad I
is
asked.
that the team agreed by consensus that joint training amongst all the departments and offices would help to advance this initiative and reduce domestic violence and opioid overdoses and provide support to those experiencing mental health and substance use issues in our community. So.
Was there anything about reporting discussed in there?
No, I'm going to get to that point.
Okay. Okay.
Just hold on, brother.
I've got it written down.
Okay.
So the team supported the need for full-time capacity at the Family Justice Center that I mentioned the Superior Court brought forward to be available to assist the public, and that includes our target population we're trying to impact here in this initiative. County has declared an opioid crisis. We talked about that, and all of our partners participate in some way on the task force and agreed that the campaign and additional naloxone supply was a priority. The coordination of data, which I think gets to what you may be referring to, Commissioner Edwards, is needed to track our success. I focused on domestic violence in my examples, but that also includes opioid overdoses. Last week, we had reports that various law enforcement agencies, EMS, the hospital, public health, and the coroner's office all received information about a possible spike in overdoses. That really highlighted our challenge that we have in coordinating and collecting that data so that we can respond quickly to take action and get information out to the public to prevent deaths and to assist everyone's various role in that. Law enforcement's role in identifying the source and preventing the access of those drugs that can cause death, and the other approaches to saving lives. So data is really key to our success, and we need that. We need not only a coordinator that can work events, but also possible system or tools to support that. The increased use of suicide and child witnesses of domestic violence was a huge concern, and there's really currently no county funds allocated to that effort, and we felt that was a priority. And the team discussed all the collaborative ideas that I shared with you, and these rose to the top. But our team did not reach full consensus on the prioritization order or the funding amount recommendation because process concerns were raised. We did conduct an anonymous survey and gave all members an opportunity to participate in the survey. The survey focus was just to take these top priorities and take these top ideas and try to figure out which ones were the greatest priority. There was not funding amounts attached to those, to just kind of get an idea, a snapshot as to how people were feeling after our meeting. So as you can see, the joint cross training was the top priority. The clerk's position, while the group had decided not to include it in our request, I still included that in the survey. So that's what that is reflective of. And then you can just kind of glance at that information. And if you turn to the next page, you can see how that shapes up in our investments that we recommend for this initiative.
So before we flip, I see that you had 3 respondents to the survey.
Yes.
I also see they're anonymous, so we don't know who they were, but how many participated in the team? Had they all participated, how many respondents would we have had?
About
10 members of the team.
Yes.
And 3 responded to the survey. Thank you. That's
actually, I'm going to give a clarification to that. In my survey request, though, I did ask individual offices and departments to work together to do one vote. So in that sense, yes, it would be less. So there would be about 6. Thank you.
6.
You're correct.
Thank you.
3 out of 6.
Yes.
3 did and 3 didn't.
Yes.
Better.
I see.
So, investments recommended for this initiative based upon the information that we did receive in the survey, as well as really thinking of our focus of what will best help us to achieve the strategies in this initiative and what would benefit most members of our team and what has the greatest return on investment for the public that we're trying to serve. So the first priority is that training that I discussed. As I mentioned, it also includes infant mental health for our nurses that are trying to prevent adverse childhood experiences prenatally and postnatally. Some adult mental health first aid that the courts also were participating in that. There was broad interest in that, as well as the other various topics. So we estimated approximately $20,000 for 2019 and $20,000 for 2020, recognizing that sometimes we can get trainers for free, sometimes they can be very expensive if you try to send a multidisciplinary team to, for example, an out-of-state training to become trainers. And so we had sort of a hybrid of possible trainings, but definitely felt like that would be a amount that would be able to benefit multiple members to attend. So number 2 is naloxone supply and overdose prevention campaign for the opioid task force. The amount proposed is $30,000. That would include supply of naloxone, the nasal amount. If we allocated $20,000 of that $30,000 to the supply and $10,000 to the prevention campaign, then that would save 571 lives, which is priceless and an excellent return on investment for that price.
So how many doses with 20,000? I know that you mentioned that you have a reduced rate.
Yes, we have a reduced rate of $35 per dose.
Okay.
So that's reflective of that $20,000. I should also just mention, as I'm going through this, that you'll see where it says division, public health and social services will lead and share with other departments. So we're proposing that where there's cross benefit to other departments, that we would administer that and share it with other departments as appropriate.
Look, that's why I have a question on that one. On the other initiative, in the other allocations, makes sense, a little tangible. And when you say share the data, how you will utilize the 20,000?
For the training.
Yeah, no, for the shared data analysis.
We're not quite
Are you
there
not there yet?
Yeah.
I'm sorry.
Yeah, because I've got the same.
Sure. Okay, well, I'll just move on to.
Will it lead you off on that one?
So the proposal there was that many of the departments and offices have someone within that is collecting a certain portion of that data, but we don't have a way to collect it all together. We need a staff person or a coordinator that can work together with all those different offices and departments to compile it together and share it so we can all see what that is. So that amount is reflective of a 0.10 FTE, so just about 5 hours a week of staff person to work on that, as well as to look at some different tools and ways in which we can better collect that.
So do you think that you'd be able to attract someone who would be a willing employee for 5 hours a week?
We were thinking that we would have some existing staff that we could dedicate to that. So we have.
So if we have existing staff, would you need additional money?
Yes, we would.
Are we not fully funding their salaries and benefits now?
So the idea that we were thinking thus far is that Pam for treatment sales tax already dedicates a part, already is fully funded by treatment sales tax, but has a portion of her time that we could essentially contract with to do other activities that aren't related to TST and for extra available time, which would free up additional TST dollars in a different area. So that was kind of our innovative thinking around that. And that the opioid component could be related to TST, but for example, the domestic violence incidents wouldn't be an appropriate use for that. And so that's what we were thinking. We also have an epidemiologist. We have 2 epidemiologists on staff. Their time is fully allocated to other projects right now, but essentially public health was like we could play that role of being that data coordinator, and we also didn't, especially when it comes to tracking the opioid information, we know that we need some other tools and mechanisms that may be needed, as well as some possible kind of training to make that, to train the other staff that would be involved in that to improve our data collection.
Cool, so this would be an increase in general fund, but a decrease in other funds?
Yes.
All right, thank you.
Wait a minute. How do you know it would be an increase in general fund? How do you know it won't be able to come out of some other fund?
That's exactly what she was just describing.
Yeah.
That's what this proposal
Decrease in
is.
general fund.
No,
Increase.
she's suggesting an increase
Not a
in
large one,
general
it ain't.
fund and a decrease in other funds. And
Yeah,
I
I
get.
don't want to go that way. If I can help it.
That is your.
That's your purview.
Yep, but the way that Shelley has just described it is some of this could be paid for from treatment sales tax, but the domestic violence piece can't. So.
You know what? Why can't we look at domestic violence a little differently? I think it's a mental health issue.
So we have a legal opinion on that.
Well, I'll
from
talk to her and
Elizabeth.
see if I can convince her that it's a mental health issue.
Right.
Perhaps I was thinking in terms of the $20,000, since you're going to be utilizing an existing staff position, that you may create additional capacity by overtime to meet that demand. So
Or extra.
extra help. So you still have the functions of the TST be funded, and what you do is just creating capacity, whether it gives you the flexibility of overtime or perhaps extra help on the need-be basis. I think it may be to complex to take that position, reduce the TST, and supplement with general fund. I think maybe thinking in terms of creating additional capacity.
I do. I want
No, I
to
think that we
comment
could do
one
that,
more
though.
thing on that. I think if you can't deduct that it's a mental health problem, look at what happened over in Lacey, I don't know, a week or two ago. That was a domestic violence thing that went all the way, if you will. And you can't tell me that guy wasn't nuts to shoot his spouse or whatever it was and then kill himself. If that isn't a definition of crazy, I don't know what is. And I really think we should start looking at that type of an approach on some of this.
This initiative, one of the things that I think is a great benefit to creating this team is for us to be looking at the really complex issue of domestic violence in a multifaceted way with a lot of partners that have different perspectives, and together we can look at it more holistically.
And
So I think there's opportunities.
And by gathering the data, I think it's going to give you a larger perspective as to how you can probably implement some strategies in the future.
Yes, and if we don't do that, we don't know whether we'll be successful or not. And I don't think there's any other position that we have that could really coordinate this without this creating this.
Right. I think
just
that Pam
right on
would
that topic,
actually be a good
until we
choice.
get more information from the investigators, we don't know if it's a mental health issue or whether it's an opioid or some type of an addiction issue, or both.
So any of those would fit
Would
under
qualify.
TST, yes.
Right.
All
That's
of
why
that
we
would
just don't
fit
know
under
yet.
TST. So you may want to consider
That
treatment cell
horrendous
staff.
murder case we had here a while back where the mother-in-law was killed or something and the wife was killed and some kid was, you know, I mean, you can't say that's not a mental health problem. I mean, sure, it goes down as domestic violence, but I think we need to reassess where we're getting our funding from so we can put adequate funding against the problem. Because if we keep going back to the general fund, we're never going to have enough money to deal with this.
But I mean, to benefit what Shirley's presenting, this is the request based on the allocation that you provided. So it's not an additional general
I know,
fund.
but
I think
It's
that-
general fund.
No, but it's
It's
not an
coming-
additional, it's an allocation that you give to this team to come up with some
but it's out of general
proposals.
fund. Maybe we should have rethought this before we allocated that funding.
Or you pay for this with something else and free it up for some other purpose.
And that will be
Yeah,
your
it's up to
discussion
the
next
board.
week.
Any other questions on data?
Yeah, I do.
Well,
You've got more.
you still have more presentation to go?
Yeah.
Yes.
No, I'll wait till the end. I've got about 4 or 5.
Almost do this.
On summary outcomes and priorities, down here about 6 down.
Where are you?
Coordination of data among different offices. When you talk about collecting that information, is there any, I know this is getting kind of down in the weeds from budget, but I talked to the coroner the other day, and he said the ability is there to check on some of these overdoses and see where they bought prescriptions and if they were shopping or what. And that gets back to this mandatory reporting that we've been asking about.
Or notification.
Or
as it's
notification,
called.
I mean, so that we can try to get ahead of some of this. I don't know if when an individual goes in and goes prescription shopping, if they're denied, is that entered into this equation? There's a lot of things that we could do, I think, that would help us make better decisions.
Before you answer, can I add something to that? Is in the Attorney General, Bob Ferguson just did a report on that, where he's pushing for mandatory notification to nail those people that are doctor shopping.
Yes, so you're referring to the Prescription Drug Monitoring Program, which is a state program. And yes, there is, right now it is a voluntary program for some physicians to participate. All pharmacies are mandated to participate in it. So when anyone receives a prescription for an opioid, a narcotic, such as a pain medication like oxycodone, for example, before that prescription is filled, they can see in the database the prescription history for that patient. A health officer can view that data. The state has not made overdoses a notifiable condition. That sometimes gets a little bit confused with the prescription drug monitoring program. That prescription drug monitoring program is something in existence. It's at as I mentioned, it's a state program. We support it locally. We provide information and try to educate people on that currently. Now, when it comes to how we can track opioid overdoses in combination with all this other information, such as the prescription drug database, that's a little more complex. Hospitals have different systems. Public health can have access to some of that information. If someone unfortunately dies, we have that information through the coroner's office, but as the coroner and I were discussing yesterday, that's too late. That's too late for us. We don't want people to ever get to the coroner's office, and sometimes there is a long delay before we get that information. So it's hard for us to react without some real-time information. So that example that I gave you, if Olympia Police, the Sheriff's Office, and emergency services, EMS is seeing information, they all keep that data, but we don't have one place to collect it for Thurston County. And so we're trying to, short of making it a notifiable condition and having everyone required by law to report to us, we're trying to find a way to get all of our county partners at least to share information.
What's wrong with mandatory, I mean, what's wrong with mandatory reporting? Why not do the mandatory reporting?
The notifiable condition?
Yes.
You heard from your Dr. Wood
I know.
As to why she believes it's not.
But I think we should pursue that. I mean, I don't think we ought to be letting that slide.
Well, we have to depend on hearing from the coroner when it's too late.
Yeah, when it's too late. I mean, if we're really going to be serious about trying to solve a problem here, let's solve a problem. Let's not wait until the coroner gives us a report.
Yeah, don't take the baby steps up. Just go right to the top.
For it.
We're trying to find a way to improve our data collection now as soon as possible. That is under the purview by law for the health officer to make a notifiable condition. Some communities in the state have made it a notifiable condition. Many counties have not made it a notifiable condition for various reasons, which we shared in the briefing with you several months ago. But there's still a need for us to find a way to collect the data short of mandating it. And there are ways to do that. So this is an effort to try something.
She's got several more slides.
I know, just real quick.
I got to get through this.
This funding source, every one of these funding sources are coming out of current expense then?
Yes.
Yeah.
It is
I think
your
we need to
allocation.
get more
from the
innovative
general
because
fund.
current expense doesn't have enough money. And I can see a lot of connections.
You don't
Treat.
decide that today.
Yeah,
Listen to her brief.
Yeah,
Okay,
and again,
okay.
she's presenting
Yeah, I
a
know.
proposal based on
I'm
the
sorry.
allocation
Yep,
the
go
board
ahead.
provided to this team.
Right.
You get that choice in a couple days.
Okay.
Great. Thank you. So number 4 is youth suicide and adverse childhood experiences prevention, education, and outreach campaign that would support the child death review team and the extreme team that Liz spoke to. So Public Health and Social Services would be the lead on that. Our estimated cost of that is approximately $10,000. These groups partner with schools and community groups, and we really want to try to use some best practices and get information out to the public and to our partners on how we can work together to reduce youth suicide and adverse childhood experiences, which impact Initiative 1 and Initiative 2. Any questions on that?
I'll keep going. We got to get
Yeah.
Okay.
cut them off.
Okay, and then Number 5 is the Office Assistant 2 funding request from Superior Court that I believe you also heard in the Initiative 11 presentation this morning.
This morning.
That was
From
the,
Superior Court.
that
And
was
it's-
I'm tracking.
tied to Initiative 11, but we found a connection to this initiative as well. As I discussed in the initiative,
So it's on this one.
and so $20,000 in 2019 and 2020 is what the court proposed would be the minimum needed to support their increase in cost.
From this team,
Yes.
just from this team.
Yes.
So I have a question. What is the alignment? If you can elaborate the alignment of this increase in the halftime position to this initiative.
As discussed at the meeting, in which was represented by Pam Beyer, who's representing Superior Court, and Judge Scheller followed up with additional information on this. And the connection that provided was that it provided more access by increasing hours for them to be available to serve those that may be impacted by domestic violence that are seeking services at the Family Justice Center.
So just for the clarity for the board, the court asked for $51,000 in total to increase this to a full-time FTE. Only part of it would be funded with this $20,000.
Actually, the request is for set the combination of their.
For 71.
And this 20. The request is a total of 70 plus
Oh.
1,000.
Yeah.
So I'm confused. Okay.
I'm looking at the information out of Questica.
Yeah,
It's only 50,
Oh, it is.
51.
Yeah, yeah.
There, thank you.
How can they get one FTE for 50?
No, it's
And this-
increased
Office
halftime.
assistant.
It's currently it's a halftime.
So this 20 is not on top of that, it's part of that?
Yes,
It's part of that, 50.
yeah.
Okay, that makes sense.
This position by the survey was the lower ranked in the priority, I think in part because the others have the strongest connection, benefited multiple departments. This filled an important need tied to the population served in this initiative, and so that's why we included it. And as I just wanted to point out in just discussing the initiative alignment, that all of these connected to Initiative 2, but many also connected to other initiatives there, including 18, which relates to workforce development and training, and Initiative 11, which is your law and justice, and then Initiative 12 and something I don't remember which one that was.
Sorry.
Infrastructure, technology, data. Thank you.
Right on, Liz.
Okay.
And that's the conclusion of my presentation. Do you have additional questions?
Go ahead. No, go ahead, I'm listening.
Oh, yeah. I've got, well, a couple of questions, but also some, just comments. I'm going back to the very first Initiative 2 page, and I'm looking at supply naloxone. And it's to prevent opioid deaths, right? And I agree with that, yeah. But it also says conduct an overdose prevention public campaign. We supply naloxone to educate, or does educate belong also in the youth suicide prevention and Thurston County shared social worker on call to do that education and outreach?
Just to be clear, the shared social worker was just ideas that were discussed, but were not selected as a priority request for this. But the overdose prevention campaign is tied to the naloxone distribution, because you can't just give somebody naloxone. You have to train them on how to administer it, what signs to watch for, how to support the person of which they administer it to, and we don't want to just give out naloxone without information about treatment, how to other ways in which people can educate themselves and protect themselves to prevent them and their loved ones from overdosing. So that may include things like protecting them from prescriptions that are unused by other family members that they may have access the opioid task force, part of the plan that they are currently developing will include many different strategies that we'll need to implement. And so in the restricted funds, you authorized tentatively, pending your later approval of the budget, a opioid response coordinator, which will be the staff person to help. This request is tied to something tangible that the team can do to literally save lives in these next 2 years.
So distribution of naloxone is a public campaign.
Yes, that's part of it. We frequently have requests from the community to public health from our county partners, as well as just members of the public and nonprofit organizations that say, do you have any? We would like to have some. And we have some available, the injectable form at our syringe services location, but this is a way in which we could expand the availability of it, because as we know, someone can die of an overdose in just minutes, and that can be even before law enforcement or EMS can even respond. So a lot of these lives that are being saved by their friends and family members, or if somebody comes into any of our county offices and may suddenly have an overdose, perhaps in the restroom, we would have it available right then and there to save their life.
And next is going to the investments page, recommended page, and number 3, track countywide opioid overdoses and domestic violence incidences. And I don't know what, number 1, don't know what we're missing DV stat-wise. And back in the 90s, when Olympia PD initiated a DV, a victims advocate, and outreach and education, a big push was on, and people were just alarmed. Oh my gosh, it's on the rise. Well, no, more people were reporting it now because of the outreach and education. More people were responding to it in a positive way. I don't know what we're missing DV incident-wise statistically.
Well, I can tell you at least one example. We mentioned like Arthur grants that can help to move some of these things forward. When let's say we're trying to apply for a big federal grant for Thurston County for a cross-disciplinary team to do something related to domestic violence. One of the common questions that everyone asks is, well, what is your domestic violence rate? Like, how severe is this issue, and how is this funding going to help reduce your incidence of domestic violence? It's really difficult for us to know without reporting it as well. These were the number of 911 calls. These were the numbers of DV protection orders. We already know overall about domestic violence that more than half don't ever report to a government agency, whether that's law enforcement or to a court system. They may just be served by a local domestic violence service provider or shelter. We may not have that information. But if we don't work together to collect information from multiple agencies and look at it in one place, we can't be effective in this initiative, which the key indicator of success for this is reduce the incidence of domestic violence in Thurston County. So we have lots of different pieces to a puzzle, but no one to put the whole puzzle together so that we can look at it and make a difference.
But every law enforcement agency reports DV. I mean, they track that stuff, I would imagine.
Yes, they do.
And when somebody doesn't want to contact a governmental agency, and I appreciate that, many times they'll call Safe Place. Do they report stuff to the health office or not?
No.
So we don't track that.
Domestic violence information is very protected. So sometimes we will have duplicated data because that information is anonymous. Those survivors' information is protected, so we don't ever see their name, and that's never shared by law. So,
but the incident.
No. But the incident of a DV.
Yes, that's not. There's no obligation for that to be reported by a.
No, not mandatory, but we don't seek it. They don't share it. We don't know it.
No, that's
okay.
That's correct.
And my final one, Shelley, is we were onto this a little bit ago, but I wrote this down several minutes ago. The last initiative, number 5, the Superior Court piece. And if you wanted to know how I voted, you can't figure it out. But if you want to know how my precinct where I live voted, you can. Not me, but you can how the precinct voted. So there were 6 partners that shared in this data collection or that participated in this effort. In the survey.
Oh.
3 out of 6 responded.
Yes, just to remind you of our team, it was public health, civil superior and juvenile court, the sheriff's office, the clerk's office, and the prosecuting attorney's office.
So my question is this, not looking for an individual because that's protected. But was Superior Court one of the 3?
Participants in the survey.
Participants in the survey.
It's anonymous, she doesn't know.
Oh, so you don't even know which department?
No.
Okay.
And I wouldn't,
Okay.
She's not withholding the information for you.
Okay,
Oh, I'm not done. Just
Oh, I
finally,
thought
I
you
just
said
want
that was your last
to.
one.
We got to sort out. And we already think we did the 20 part of the 50. This is not a duplicate effort from Superior Court.
It's not duplicated in the other initiative presentations, it's complementary, if you will. It all
Thank
add
you.
up to
Okay.
the total amount that they asked for.
Okay.
Should you decide to fund them all.
I relinquish the reign of my time to one of my colleagues.
You mentioned that there's certain situations where other family members are exposed to dangerous products like unused prescription drugs and that type of thing. And we're trying to get everybody to work together. Last I knew, Olympia didn't have one of those drop boxes. Have they finally come around, and do they have a drop box now?
I recall this conversation, I don't know the answer to that, but I do know that the state legislation that was passed last year will go into effect next year, in which the drug manufacturers themselves will be responsible for providing those drop boxes and properly disposing of those medications. So we will have an increase of available unused medication disposal sites.
But so far as we know, only Yelm, Rainier, Tenino, and
Sheriff.
The county, Lacey, and Tumwater have them, right? I'd like to know at least the answer to that, so somebody asked me.
Well, the
At some point,
legislation,
not today.
legislation says it has to be.
I can get you that information, but I don't have it.
Okay.
It has to be provided by whom?
The drug manufacturer.
Drug manufacturer, but doesn't say to whom or where it's mandatory, where someone has to have it.
I don't believe the legislation will include that specifically.
Okay.
All right, that's the questions I had. You had other portion of the brief?
Thank you so much for your consideration and for your support of and domestic violence.
Oh, you bet.
Very good, thank you. Thank you both.
He's showing you.
He showed me our pin here.
Well, I had it on this morning, but I took it off.
Your domestic violence and
Thank you for your patience and your professionalism.
Yes, thank you.
thank you very much.
All right, we're going to take a break. Yeah. Take a 2-minute break.
Is this the one where you're supposed to turn your mic off?
Good afternoon. We are working on budget work sessions, and coming up next is your last team presentation, your last strategy team presentation. It is Health and Human Services, and it's focused on the initiative number 4, strengthen emergency management planning and community disaster preparedness. And you have Kurt Harden is the champion, and Shelley Slaughter also involved in this initiative, and they're here to make this presentation to you.
All right. Kurt, you got the floor.
Yeah, good afternoon. I was going to go ahead and start off by saying that we've been collaborating We've been collaborating emergency management and public health over the last couple of weeks to come together with this budget presentation. Appreciate the willingness to work and partner with public health. Even though this reaches out and touches almost all of county government, we're the 2 driving factors behind this. So as you see as we go through, we'll be talking to our budget request here. Just wanted to give a real quick, the mission of public health and emergency services, and also underneath emergency services is emergency management. So this is real quick, just a reminder of what we do and what our mission is within the county. Initiative 4, as Robin pointed out, you have it here, and talking to what Initiative 4 is. If you look at the indicators of success, the departments and offices that complete the continuity of operations plan, which is we have a work in progress on COOP, and also public notification sign-up rate. Those are 2 indicators of success. Shelley and I have talked a little bit about some additional indicators of success that we would like to also try to incorporate, because as we move forward, and there's a lot more we need to look at for public health, emergency preparedness, that we can help leverage and they can help leverage in working together. So what we did was, we talked about a couple of different areas, and we did some collaboration on not just where we were going with our budget level requests, but also what other areas did we see that we needed funding that may not be there, because we realized there's obviously a lot more need than there is resources. But we sat down and went through where can we come up with, and what other areas would we need resources if, say, there was a windfall of funding and the state or the federal government decided to grant additional funds to the county. And so we've got these in here. We're going to talk a little bit about them. The first one that I was going to talk about is COOP and continuity of operations. We've seen that COOP is not just for disasters. COOP, we've had 2 situations in the last month where the courthouse has lost power for a half a day and then a all day. And I will tell you that those agencies, those departments that had a COOP plan in place were able to effectively deal with it. And I'm going to use the auditor's office as an example. They fired up their COOP plan and kept in business and kept their offices open with critical essential functions. Some of the other departments, one of the courts did a great job of, they didn't have a COOP plan, but they also did a great job of keeping their offices open and keeping the services going for their law and justice situation. In fact, to the tune of the judges apparently bought pizza, which I missed out on, so I'm going to go back and hit them up for some pizza later. But bought pizza on. But they did that on the fly, but if they'd had a COOP plan in place, that might have helped them do that a little more efficiently. So one of the things that we're looking at is COOP and how we can turn around and help enhance our COOP capabilities across the county.
Sure, and I just wanted to speak to the next 2 items, which are partnerships and community group assistance and public education, which are key functions for both emergency management and public health, particularly our public health emergency preparedness team. We are really there for the community and key to providing information when there's an emergency in our community and to help the public prepare. So it's not only an internal county function, as Kurt was just referring to, but external. They're depending upon us. 2 examples of which this is an important happened in our community this last year, and that was the DuPont train wreck, as well as the shooting that happened at Walmart. Both of our departments were involved in those incidents and had different roles to play, and one of the big ones is helping families that have experienced trauma, whether they were involved in the accident or they were trying to find find their loved one, trying to figure out which hospital they were at. So tracking where the family, where the patient is, and supporting the whole community in how to recover from that is really key. There was a joint, many departments participated and community agencies participated in a resource fair after the Walmart shooting to provide support to the families and the communities, and that is really key in recovery and in public health and helping people to prepare again.
Yeah, the next item we talked about and we looked at was Department of the Public Health Department Operations Center and the Emergency Coordination Center. So when there's an activity going on for ESF8, emergency function aid, which is health, the Department of Health has an operations center that they fire up and they staff and man, but there's also situations where the Emergency Coordination Center activates as well. And so one of the areas that we're looking at is how can we develop and put into place those procedures so that we have a process that we follow each and every time. I will tell you that the staff of both public health and emergency management make it happen every time because of their professionalism, and we've got very well experienced staff both in public health and emergency management. But I will tell you that we have to have it in place so that if somebody walks in the door and it's their first day of public health or emergency management, they'll know what to do because we have the procedures in place.
Hazardous Weather Task Force, I know Commissioner Blake is very familiar with this. So the Hazardous Weather Task Force has been convened over the last year and is specifically named in the Board of Health's declaration of a homeless crisis to provide emergency shelter to the most vulnerable citizens, those without housing, during extreme weather conditions. So that is when there is prolonged periods of extreme weather and our additional capacity for cold weather shelter isn't sufficient. So we have a request related to that as well, which we'll discuss later. Oh. Sorry. So one of our other needs is to be prepared for a public health emergency. So in this last year, we had a water and health emergency related to Summit Lake, and on any given daily basis, there may be several public health threats that can really tax our resources, and we need to be able to immediately respond. If we have a large outbreak, if there's a communicable disease of important significance, such as Ebola, that comes again to our community, we have to be prepared to act. And if we don't have funds reserved in place that we can immediately access, then that can delay the support services that we're trying to provide to the community. So in essence, it's just important to be proactive. The Board of County Commissioners has responsibilities, of course, for the whole county. The Board of Health has even more responsibilities in ensuring that that we are able to fulfill our duties related to protecting the public health in times of emergency.
And for the next one is a county emergency fund that we've talked about before, because we briefed the commissioners a couple months ago on a county emergency fund. So I'm not going to go a lot in detail into that because we've already talked in depth about that. The next one is the Alert Sense, and that is our Thurston Community Alert System. And that one is where we want to integrate that into our COOP and also integrate it into our communications plan, especially when we talk about integrating it into the COOP plan, because each department within the county and other special purpose districts within the county and other cities within the county can take the Thurston Community Alert System and they can utilize that to notify just their citizens or their workforce or whatever the situation warrants or dictates. So we want to increase the sign up and participation in the Thurston Community Alert system as well.
Another area in which it's very important that we are coordinating and ensuring that we have available in our community is our MRC and DART teams working together. So that's our Medical Reserve Corps, that is part of Public Health Emergency Preparedness, and DART, which is disaster assistance, readiness response team. And So we really rely on training volunteers that have both expertise in perhaps the medical field or not in other areas to help us respond to disasters, especially when our staff may not fully be available. So when there's things like the fires that we had last year, which we anticipate we will have again and probably again and again, unfortunately, it involves a tremendous amount of coordination of resources of people that are ready to help and ready to provide supplies, but we need coordination to do that. Other things that we need in times of emergency, sometimes we don't have the funding available for that. So that includes things like masks to protect both our employees and the public from things like smoke or chemicals or hazardous materials that may relate to that disaster response. Massive vaccinations, drinking water. I gave the example of Sump Lake. So there's times where we need other resources, both of people and of items in times of emergency.
The next one I have is the limited English proficiency. And what we call LEP, or limited English proficiency, was passed in 2017 by the legislature, and it requires local jurisdictions and for us, the county, to come up with a plan to address limited English proficiency and communications and outreach during times of emergency or disasters. I will tell you that I believe this, Commissioner Edwards, is what we call an unfunded mandate, because there was no funding that came with this. So the county had to reprogram and repurpose one of our grant sources and our grant streams to accomplish this objective. We did it with a 5-county partnership in our Homeland Security region, but it still took federal funds away from what we had already earmarked them for to be able to accomplish this requirement. Now, as the follow-on is that we need this be able to put, once the plan is in place, to be able to execute the plan, we have to be able to turn around and translate now certain criteria, certain evacuation notices, other warnings or alerts that we can put in place in our stock notification processes. If we get them done now, we're ahead of the game so that we don't have to try to do it during a disaster, but also it's going to cost funds, and it's an unfunded mandate. Although the state did see fit to fund at the state level $180,000 a year for state resources to do this, but they didn't seem to see fit to fund at the local level.
That's related to a 5% of certain group of population.
Yes, that's it.
So do we know the makeup? What part of the population meets the 5% threshold? Do you know?
Ours is Vietnamese and Hispanic.
Okay. So it's two.
Yes. Although it could be in King County, I believe they have over 20, so it could be worse. We could have a lot more to translate. So 2 is more than sufficient.
So those are just the ones that are over 5% or
5%.
something, right? Because we got, like down in Rochester, there's a Russian community, and could fire, say on the alert sense, would they be able to plug that in and make those calls in another language? Is that part of it?
I believe they have the capability, but I don't believe the fire has the budget or budgeted the funding to be able to do the translation as it stands today.
Okay.
Because that's, again, for them, it would be an unfunded mandate as well.
Okay.
That's an area that also impacts public health, because when we're trying to get critical public health information, such as alerts or about emergencies, we have to make sure that it's available in every language spoken in our community. That becomes really important when we have events such as communicable disease outbreaks at schools, and we need to provide both written materials and have people available to interpret when we're serving the public. So there's a much broader impact on this particular mandate, and it's just really important that that's really the most important thing. Not that it's a mandate, but that we're able to serve our community. So the next requirement that we have is another mandate by CMS. So any federally funded Medicaid provider, including hospitals and first responders, are required annually to participate in joint training along with all of us. That's something that is a new mandate. And we're still trying to plan for how we're going to meet that needs and how we're going to meet that requirement and coordinate with our local community and to achieve it.
Shelley,
Yes.
can you explain what is CMS for the other two?
I'm spacing out on it.
But it's Medicaid, isn't it?
Yes. Robin?
From CPAA.
Is it Community, I don't know what this one is.
Tell the story.
I so apologize that I can't remember the acronym.
See if I can find it.
It is the federal office that is responsible for Medicaid, and I just can't remember the acronym right now.
It impacts for
Oh.
For Medicaid services.
Yes.
Oh, I should know that.
That's really all I was wanting.
Yeah,
I just wanted him to know.
Yeah.
I just knew he didn't know what CMS is.
And it impacts first
Yeah.
responders as well.
Center,
Centers for Medicare.
thank you. Geez, centers. Yeah, good to spell this stuff out in slides. Yeah.
Okay, so now that we remember what CMS is, because we use it for first responders as well on EMS. So the next one is Capital Campus Joint Exercise. In fact, we have a meeting, Sandy and I have a meeting next week with the Department of Enterprise Services, their emergency managers for Capital Campus, because one of the areas is that public health is a responsibility for Capital Campus. If something came out that required a health response, or if there's something came up that required an EMS response as well, we have the responsibility to be able to meet their needs over there. And so while we need to sit down and do a joint exercise with them because we want to be able to train and then exercise that plan. One of the challenges also is we don't receive additional funding, at least from the EMS side, additional funding for working with Capital Campus and providing those services. Yeah. So, out of all the, let me see if I can jump a little bit. Okay, so for our first priority, what we talked about when we came together was our need for a South County position within emergency management. One of the reasons we looked at this is that we truly need to provide services to Rochester, Tenino, Yelm, and I'm leaving some. Thank you. I'm going to hear about that in a minute. But
Bucota.
In Bucota, yes. In fact, that was just their
The
last.
thriving metropolis of Bucota.
Yeah. What we're looking for, though, is this position is going to be put in there to help with our CEMP planning. That's Comprehensive Emergency Management Plan. That's a requirement by the state under RCW 3852070. They're required to do CEMP planning as well as the county is. Mitigation plan, COOP plan, COG, that's continuity of government. And so one of the things we've decided is that we can no longer afford not to help them because if a disaster happens, it does not respect boundaries or jurisdictional boundaries. So one of the things that we see that is they're going to be on our doorstep. And so the planning and exercising that we can do with them now will pay off dividends, an ounce of prevention's worth of pound of cure, as we like to say, down the road. How we're looking at this is we're requesting an FTE and $50,000 of general fund. The counties, or correction, the cities that we're looking at, the South County cities, will provide about approximately $12,000 for disaster preparedness. And that we're looking at as funding a half-time FTE. We're asking that it be authorized as a full-time FTE, and we can hire at this point in time with a half-time FTE to start the process. But we want to leave open the possibility of bringing it in as a full-time FTE if we get additional non-general county general fund resources available. There are constantly differences or new homeland security initiatives or grant funding at the federal level that may be able to help us out down the road. But right now we're asking to be able to fund it at a half-time level and then be able to expand it if additional resources become available.
Well, a question. I don't think we can add a full-time position and be funded half-time. I think it has to be a half-time FTE to begin with. And then you have the opportunity when the funding becomes available to upgrade it to a full-time, okay. And that will be a different action.
Okay.
So I have a question. The allocation for this initiative is $50,000, right? Mm-hmm. So if priority number one is takes the whole allocation, is that a recommendation by the team?
Right. And one of the other pieces for this is this FTE is it's going to be able to cross over into working with ESF 8 and their emergency preparedness areas as well, and help out with public health in that area too.
Yes, I'll just add
that acronym means? ESF 8.
Emergency support function 8 during disaster response, everything was broken down into ESF.
Okay.
And that's the healthy piece before the start.
Yes, one of the things that we discussed was, with the list that we shared with you earlier, if there was functions of this position that could support our role in emergency health, public health preparedness, then we definitely could see there's definitely joint value in that position. But our approach was to provide you a menu of options in priority order.
May I jump in?
Jump on in.
Okay. With South County, you're talking about helping to develop their emergency management plan.
Helping them develop their emergency management plans, such as the CEMP, the COOP, the COG, but also signing up for getting outreach for a Thurston Community Alert System so that we get more participation there.
So I would imagine it would take 5 years to do PCODAs. And I'm being exaggerating, obviously, but it might take a year to do, or maybe less, I don't know, to do Tenanos. But they're all going to connect. They're going to use similar services and response areas and evacuation zones, that type of stuff.
From the county.
In the county. So,
From the county.
or from. So my question is this: is this the type of thing where we could, rather than an FTE or a 0.5, where we could use a college intern to put this stuff together, and they're obtaining credits, but they're also knowledgeable enough to work on this and get it done?
Well, I think the interns are really great, but the challenge is they come in with limited experience. They're there to be able to provide assistance, but they're in a learning capacity. The other piece on this is that you have to write the plan, then you have to train to the plan, then you have to exercise the plan, then you have to do the after-action review of the plan, and then you have to go in and then adjust the plan and update it. So it's a continuous process, and when you're talking about those multiple jurisdictions down there, and then the other piece is working with health and working with ESF 8 and those common functions for emergency preparedness. I think that easily takes care of that position and somebody doing that position. And you also need someone who's experienced because, again, we use that intern, they're going to be great at writing, but they're going to ask, what do I write and how do I do this? So they're going to come in wanting to get that experience, which is great, but also we have some challenges with having someone who can write that.
Plus with interns, one of the problems is you lose that continuity.
Correct.
Because they come and go. All right, thank you.
We can go back this week.
As you move forward with this, hopefully, in South County, we've had quite a few floods, and I don't know, we had that fire down in Rochester, but mostly everything is flood that I'm thinking of. Is there any reason why it has to come out of the current expense budget? Why it couldn't come out of stormwater? And the reason I say that is because stormwater creates floods. And if we don't manage our stormwater properly, we have floods. I really think maybe there's something there that we could stretch a little bit.
The emergency response, I assume,
really
is
big stretch.
That's right, the road. When I look at
Flood burst and stormwater.
Yeah.
Maybe.
but
like bubble gum kinda stretch.
Emergency response is beyond flooding.
If you really think about flooding, flooding never occurs unless there's storms. Storms occur with water. And I really think there is something there.
So before I
We have to
give
be
my-
innovative.
I understand, Commissioner, but the intent of this position is to look at emergency response on all
Yeah.
different type of emergencies,
Disaster.
including earthquake and
But
everything that comes
mostly
along
the
with it.
reality is it's mostly water related, and it's mostly stormwater
How about
related.
volcanoes?
Floods, wind, fire
didn't have
are
much
the
of a
top
problem.
three.
There's
There's
a
the
lot.
wind and the fire in
Well, we
there.
haven't had problems with, really, with
We
wind.
can
I
get to
remember a
the
group,
fire
Earth,
because
Wind,
you
and
need
Fire.
water, and that comes with storm.
I want to look at all these options.
I don't
I
think
think
so.
we're limiting ourselves too often.
Sounds like a rock group, Earth, Wind, and Fire.
Yeah, it does. A pretty good one.
Anyway, I just think it's worth looking at. We need to, we don't have money in the general fund. We have money in other funds. We need to start being innovative.
Stormwater.
Stormwater.
What do you
Yes, we are ready to move on.
Wait, there we go, okay. I'm going to speak to priority 2, the 13, the hazardous waste task force code blue sheltering. So the homelessness crisis is related to initiative 2 as well as this initiative.
the Board of Health declared homelessness a public health crisis, and one of the taskings in there was to convene and develop the hazardous weather task force and to seek out resources to shelter that vulnerable population. Part of what the task force has discussed is having each jurisdiction identify a facility or site or staffing that and resources and supplies that could be utilized during a code blue disaster. So there have been requests made to the City of Olympia, City of Lacey, and City of Tumwater to identify a site and participate in funding the code blue portion of the plan. The housing support and sheltering provided in our Fund 1400 presentation that we gave to you is our contract with shelter providers during the normal all year round as well as during the cold weather season. We do not have funding designated for the hazardous weather task force and to implement that code blue plan, specifically in the role that the county would play, which does not just impact public health, but would impact emergency management. They've been participating in the hazardous weather team as well as many other partners and the county manager. We've all been part of that team in trying to come up with what we would do and what we anticipate we're going to need to do likely this season. So when we have extended hazardous weather, we need to have a site ready, and this was one of the citizens' top priority in the Burke survey was responding to homelessness, and people have been looking for what resources we might contribute to this. So this is our proposal for that.
So, do I understand that the 25,000 would be used to stand up a site, to equip a site? And if not that, what would it be?
So this particular piece is for the county's role. So, and by that I mean, yes, every jurisdiction is being asked to identify a site of which could provide expanded sheltering to the community during a prolonged code blue declaration. So essentially we don't have that, and it takes some money and some planning to both identify the site, make sure the site is equipped, make sure we have the supplies, make sure we can contract with staffing, make sure that we have our liability ready, and essentially that we're playing our role with our other government partners in being able to provide shelter during hazardous weather.
Right. So when I'm writing the check, I'd be paying for equipment, a space. What would I be paying for?
All of that.
All of those things.
Renting the fairgrounds.
So, all right. So then my next question is, could we use the housing fund?
We think no. And the reason why is because all of the specific funds that are allocated for that, which include emergency shelters, so that's like our consolidated homeless grant, our document recording fees, all of those things are subject to the homeless housing plan and all of the various activities and support services that are required for that. There's not funding in there that's specifically designated for standing up a county facility to provide this support. In addition, I think that it leverages other funding and support from our partners when the county is dedicating some of our own funds to this effort. We know that we're asking other jurisdictions to do the same, and so we're proposing that we're a partner in this that is beyond our normal funding that supports the homeless crisis. There is not enough resources, even with the increase that we have, to respond to this issue. What our community is currently struggling with is it's going to be freezing cold. We estimate that we have hundreds and hundreds of people that are unsheltered right now, and we are very concerned about how we're going to be able to mobilize to save them from
save their lives essentially. And
Right.
so we have a really important role in that. And like I said, this isn't just a contracting with a nonprofit to provide the service. This is something that will involve likely multiple county departments in coming together to have a resource that we can bring to the table.
Sure, and I absolutely agree. There's nowhere close to enough resources. If we put all of our general fund, all of our housing money, all of our public health toward this, there wouldn't be enough. But I'm just trying to get clear on if the board should make this a priority, could they use the housing fund? So, and I understand it's not currently in the plan, but could they make an addendum to the plan? Could they choose?
So just to be clear on that, the plan that did include an addendum that referred to hazardous weather task force. So it's not that it's not in the plan. It's that a lot of the funding that we receive is utilized for services for nonprofits and not directly for the county's particular role.
Right.
So if we could, I will say that if we had a portion of these funds allocated, that we would only use them if needed, and there'd be some just for the preparation so that we could activate if needed, but if we didn't activate, we wouldn't need to use this. And if there were other funds or components of document recording fees, for example, which is our most flexible source of funds, if there were pieces of that which could pay for components of this, then we could, but we don't think that it could cover all of it.
Okay.
Okay, I still have to say, I think we could do something like set aside Heritage Hall for a period of time as part of a plan. We could put mattresses over there that are surplus mattresses from the jail that could be part of the plan. We could have water stored over there, could be part of the plan. We already have restrooms, we have heat. We could have it set up for 75 people. And mattresses are a big thing to sleep on versus the floor when you're keeping people warm. So I think we can do some in-kind type commitment and get away from spending our current expense money on, I mean, I'm not saying this isn't a good venture to go for. We don't have money in the current expense budget, and I just can't justify taking money out when we can do other things. Then we could get a little program with IT or something to bring folks over there if they needed a ride for, and stay there 3 days during a cold weather time.
But all that requires money. How are you gonna pay for transport? How are you gonna pay for the water that you're suggesting?
Fuel.
And the fuel. So all that requires money. Who is going to be driving the vans? Who is going to be participating in transporting those individuals?
Well, I'd be taking that money out of the federal homeless money. I don't really care that the other jurisdictions don't think we're putting that in.
I understand your concern about the general fund, but if I may say, this particular request is to deal with emergencies above the baseline. Mm-hmm. And the last season, we activated a couple of times the Cold Blue, which all the providers who provide shelter saw the spike on the need, and that's when there is a need for resources to respond in terms of buying food or to respond.
Hygiene products.
All that. So all that is really an intent to have this funding, because as the Hazardous Weather Task Force team, we are requesting the cities to come up with that. And I think if we're going to be taking the lead as a county and responding to those spikes during the cold weather, we need to come to the table with resources.
I don't think that we ought to be taking the lead as the county myself.
We have taken.
Well, as far as I'm concerned, we can't be raiding the general fund at every turn. We have to come up with other places to get money, and I'm sure we could figure out ways to truck people out to the Heritage Hall, put them up, get them in, warm them up. There's ways we can do it. We don't have to keep taking money out of general fund. We can take that money out of another fund.
Part of next week's conversation.
What's that?
Yep. I said that is part of the deliberation for the board for next week.
Okay.
Thank you.
He has a question. Hang on.
The policy was 150. The policy allocation 150,000.
So there was 100,000 for the initiative that you heard earlier and 50,000 for this initiative, yes.
And even, okay, total 50.
So that's-
Add this up, this is,
Right,
okay, I got it.
Yeah, they're just giving you options.
yeah.
Okay.
I felt like this was the most appropriate, given that there wasn't anything allocated to Initiative 3 of homelessness, given the high priority that you have had for this issue and that the public has to bring it forward in this way, so you have that option.
Right. No general fund allocation to that initiative.
Yes.
Yes.
Thank you for that clarification, yes. We provided support for that priority initiative in our restricted funds.
Right.
Question, do you remember what the, maybe the CDBG, where we're at in the process?
Yeah.
Is it Lacey, Tumwater, or county? I can't remember what's coming up.
County.
The county's next
The
year.
county's turn.
This year was Tumwater, so the county is next
This
year.
might be a good use of CDBG.
Sorry?
This might be a good use of the,
That and the point for the,
that's an interesting
just thinking,
idea.
that's all.
For the emergency response.
Yeah, that'd be a stretch, that'd be a big stretch,
But it's-
but we could certainly look at
Yeah,
it.
it's just something to look at, that's all.
Yeah,
And it wouldn't eat up all that
it's a
money.
very interesting idea.
Because the counties, for the county's portion that is coming up next year is a set amount for that year.
Right.
And
Hey,
then
that's the
another one for
mayor's
It's
and you
gotta be
decide,
the
I'm just
poverty,
saying,
only in the
whatever.
poverty areas, that's the trick
Just
to
So we
that.
have, no, but we'll have to see what this qualifies.
Yeah, that's an
Yep.
interesting idea.
All right, just a thought. But we gotta have it. So,
Okay,
Okay, so I'll just speak to priority 3 very quickly as well. We already touched on that public health emergency reserve. That was public health and social services submitted a $50,000 request to set aside money in case of emergency related to public health. Just to prepare for things like I mentioned to you already, we just would rather be proactive and think ahead and have some funds designated so that we can instantly move on whatever that emergency is and meeting those needs. It also would include the MRC DART coordination that we talked about earlier and training resources and supplies that we may need during that type of disaster. So merely we just wanted to have a chance to ensure that if you were considering a county reserve, that there would be a Board of Health consideration.
And then the last one we had for priorities was the limited English proficiency, because again, having the materials in hand prior to the disaster occurring would speed up the process for notification and ensure we wouldn't be slowed down by having to do quota translation services in order to get that information together.
Ta-da!
So,
Ta-da.
so subject to your questions, and I would say that we would recommend that you fund this initiative 100% first, and then you can start sorting through the rest of the initiatives after that.
Just because you're the last presentation.
You only want to say it.
all righty, any other comments?
No, just again, once again, I truly appreciate the work of the team to come forward and think through. These are difficult things and not a large amount of money to work with. So I think that they have some creative thought, and it's great that you said, here are the next things should more money be available. So I appreciate that too.
Do creativity with CDBG.
Just a thought. That's also a family discussion, because I've been down that road where they'll not let you have a penny, but that's a different story. Did you have something, Sandy, you want to say, or Joy, Shelley?
Just one other thing to the point of the creativity funding and CDBG is just timing and cycle. So if this funding were available, or there was some other funding available, January 1st, which is the peak of our cold weather season, is the time in which we would need to access resources.
Right.
Our current funding cycle with our Fund 1400, all of those other funds, those have been already contracted and allocated for this whole next year. So that's just something to keep in mind, is we're really, and that's something that I shared with the cities, because some of the cities have some of the same questions of, well, can some of this be funded by document recording fees, of which we all contribute to in some way? Could it be utilized for that? Part of that was those have been fully contracted out for this next year. We have just a little bit of emergency funds available, and you have some of those requests coming up. So we have a crisis in front of us right now, and that other funding is not going to be available in time. So there's an urgency to this request.
So when since we're talking about this one again, when the Code Blue was activated in the past, how was it paid for then?
So the Code Blue that we had was a practice Code Blue. We had various levels of Code Blue, and it did not extend beyond the 72-hour time period that is officially Code Blue. So basically, what we did was we used existing shelter resources and contracts that we had, and emergency funding that we still had available from last year to compensate our nonprofit providers that could fulfill that capacity. They since told us they don't have the capacity to do that again, and our numbers of homeless population have far exceeded even what we had 1 year ago. So we couldn't do that again. We're to the point of, we know our existing system is completely beyond capacity. It's going to require counties and cities to come up with other solutions to meet the needs this year.
Gary has a response.
No, not particularly a response, but you piqued a comment. I guess you drew a comment out of me from, you said that we're in a situation where we've got an emergency pending, basically. And I agree with you. Winter's coming and we can't do a darn thing about it. And what bothers me about government is we're always trying to spend money to solve a problem. And if we could fix the Landlord-Tenant Act, and I've talked with legislators and some of the homeless advocate folks, and get that through the legislature maybe this coming legislative season, then next year we don't have to be looking at spending money, because there's a lot of citizens out there that would be willing to help these folks during cold weather times, but they can't take a chance in being stuck up against that Landlord-Tenant Act that requires them to go through the court and the notification and all that. If we could get some kind of an adjustment to the Landlord-Tenant Act, it could get these people off the street. There's a lot of well-intended people out there that are willing to let folks stay in an outbuilding or a garage or something that is heated, and kind of do their part, if you will.
Can I ask a
It doesn't
question?
cost anything.
If we get the Landlord-Tenant Act, the first day it would happen would be July or June or next year. It won't be this November.
Oh, I know. That's what I'm saying. We have an emergency coming for this winter,
Okay.
but let's plan for the emergency next year. That's what I'm looking for, to try and think ahead on this stuff.
Well,
One of the great things about, sorry, Commissioner.
I was just going to put that on the agenda for us for the county legislative thing.
Oh, okay.
We can do that.
Okay.
We can attack
Great.
it and then put the hat with the housing action thing.
He'd like to add that to the county's legislative, if you didn't catch that.
The hazardous weather task force and the housing action team and the homeless housing hub and continuous care have been working really hard to find lots of creative ways, in-kind ways, leveraging the faith community. I mean, there's a lot of people that are working together to find solutions, and including policy solutions as well to the affordable housing crisis component. And just one other thing that I want to say is just a reminder that in this particular crisis that I'm talking about, you declared a public health emergency. The Board of Health has jurisdiction for the entire county and is responsible for the health and well-being of all of our citizens, regardless of what zip code they may be in.
Thank you for clarifying that. Very good.
Kurt, anything? Anybody else? Thank you very much.
Thank you.
Thank you. So that concludes